Good morning, everyone, and welcome to this, our 11th Digital Health and Wellness Summit. I was reflecting with some old friends there as to what it was like 11 years ago in Barcelona. We were in a different location, if all of you remember, downtown, and we opened the conference at that time with, I think it was 20 people in the audience. Today we have, I think, 800 people registered for this room, so you did very well to get in and get a seat. But I just want to say to you, we've tried to construct a program today which is inspirational, I hope, exciting, and particularly deliberately global. Because what we wanted to do was to make sure that we're in a global world of health, digital health, and so on, and we can learn so much from other people. And last night at one of our dinners, I was able to introduce the Catalonia, Jordi, who many of you know and some of you work with, to our friends in the African CDC. And I see Catalonia as a great example of a region moving towards digitization. Remember years ago, some of you will remember Joan Cornet, for example, looking at a center somewhere in Barcelona. I couldn't find it again. But there you were already tracking and encouraging people to pick up their prescriptions from their local pharmacy as opposed to a designated pharmacy decided by the authorities. So these were the things you've been doing over the years. So I see Catalonia as a shining example that we should take that and move it around the world. So later today we have a meeting with the African CDC, the World Health Organization, to see if we can twin in some way. I don't know how we're going to do this yet. Twin in some way the advances you have made in Catalonia with those that are needed in Africa, in the continent of Africa. So today you'll hear from many inspirational speakers. My role is simply to say hello. My name is Brian O'Connor from the ECHAlliance. You see, we call ourselves the Global Health Connector. I think you'll find in today's program we're proving that we have those connections, those members throughout the world. Today as well, we hope you will have an opportunity to talk directly to many of the speakers. So this isn't just a broadcast to you all. We want your involvement, and there will be ways in which you can ask questions during today. Believe it or not, that's my role finished, at least for this morning, and then I'll go and have a sleep, I think. But what I'd like to do is introduce my colleagues who will moderate the sessions from now on. So introduce, first of all, many people know him as Tall Andy. We call him Andy Bleaden, who's our Communities and Membership Director, and also, of course, our Innovation Director, Karolina. I won't attempt to pronounce her surname, her Polish surname. I have difficulty with names, but I leave you in the capable hands of these two. But please participate and please connect. Our role is connecting dots. So thank you all for being here. Thank you.
Good morning, everyone.
So, good morning, everybody. This is about audience participation today. We're a connector. You want to know what the Global Health Connector is about? ECHAlliance are the Global Health Connector. I want to just roughly go through a little bit of information for those people who don't know who we are and what we do, okay? We're a Global Health Connector. We're a member organization. Many of you here are members already. You'll see leaflets on your chairs and all around you with the information that you can see behind me on it, okay, about what we do as a member organization. It's very complex, boiled into 4 words, okay? We connect our members together. So yesterday I hosted a session, 2 sessions with my colleagues for nearly 50 of our members, just to actually physically make some connections. Because obviously we promote what our members do, but actually to connect them up together, swap business cards, learn stories, understand collaborative opportunities, is really important. That's what makes me tick, okay? So that connection piece is very, very important. And hopefully you're going to do lots of that today. So scan cards, scan business cards, etc. We also convene our members together and we bring them together in ecosystems, okay? Ecosystems are quite common now, but when we first set up over 13 years ago, they were very rare. And those ecosystems, I should talk to you about how we work with them and where they are in a moment. But to convene people together is really important. And we do that here. So many of the people you're here today are members of ECHAlliance, who we think have got good stories to tell about healthy aging, women's health, green health, and data and digital health. Then we also amplify what our members do. So we might publicize what fantastic innovation comes out of VTT in Finland, or from the University of Bologna with colleagues here, or from or even promote what Joanne Cornett's still doing with the innovation piece that he's involved with. That ability to be able to amplify your message as one of our members is important, because that message goes out to another 23,000 people via a newsletter. Okay, newsletters are fine, but what does that mean in practice? We have a LinkedIn community of over 50,000 people that will understand a little bit more about what happens at VTT in Finland than they would do perhaps through the normal channels. So that amplification piece is really, really important. And then lastly, because I've been in health for 35 years, I want to get a move on, okay? I'm bored of waiting for things to run and pilots to finish, etc. So we want to accelerate the adoption of innovation in digital health. For me, that's crucial, because innovation without adoption is a waste of space. Okay, our types of our members you can see here in breakdown. This is for the people who like to count stuff. I can't read what it says on the screen behind me, but what you can see quite clearly is the vast majority of our members are not-for-profits. They're hospitals, they're universities, they're patient organizations, okay? They're also networks and associations. They're also large government bodies, municipalities, ministries. You can see the types of members on the right here. It should give you a breakdown. We also have companies join us because they want to listen to those other members, okay? So I talked about ecosystems. We bring people together in ecosystems. What are ecosystems? They're permanent. They're multi-stakeholder gatherings, bringing all the stakeholders of health together, but to do things. And the very, very crux of the matter is, it's not complex. There's no science behind this. It's about matching need and solution. So, audience participation time. How many people we got in the audience? Hands up if you're a policy maker. Hands up. That's hands in the air. Yeah, lovely. Look around. This is cheap networking. Take advantage. And how many people are from hospitals? Companies? Oh, look at the companies. Okay, universities. Patient organizations. Okay, so we bring them together on a topic such as diabetes. And we say in Barcelona, what's the need around someone who's got a recent diagnosis of diabetes? What the services do they want? Listen to them first. What do policymakers want? What do health professionals need in terms of solutions? What does Sami Perla want from the research side of things? He's just walked in, he thinks I can't see him, I can. What does Sami Perla from Seinäjoki need in terms of access to research data? And then we flip it and say, well, what does good look like in Finland, in VTT, or in Seinäjoki, or in Spain? What's best practice? And bringing that best practice together is essential. So we then match need and solution and do stuff. It's about breaking down silos, transforming healthcare, and also creating economic opportunity. If you're interested in finding out more about that, come and see me or any of my colleagues, because we want to plug you into a network that's global, okay? That global network is all the way from Argentina, who's sat down here in our audience. Good to see you, Andrea. Fantastic to see you. All the way around the globe, we've got A to Z of ecosystems into Zimbabwe, and then back into Australia. So the A to Z and back to A again of ecosystems. If you're not on that map, come and see me. If you want to get involved with those ecosystems, many of our coordinators are here today. We also do collaborative work with our ecosystems and our members, and we've built an infrastructure of thematic ecosystems. What are those? They're horizontal. So instead of having a vertical and in a geographical zone, I can bring experts like George Margelis around healthy aging from Australia, Tim Corbett from New Zealand, people from Canada, people from Latin America, Southern Europe, Northern Europe, around the areas you can see here. We're launching 4 new ones this year. Healthy aging is one of them. We've got a topic on that today. Women's health, vital for our community. We're launching that this year as well. We're also bringing together an ecosystem on green health, that Caro leads, and one on data and digital. These are fantastic opportunities to globally connect some dots, as Brian was talking about before. There are also fantastic opportunities to showcase our members outside of where they currently live, because most of these will take place online. Trying to get George although George stays up most of the day and the evening in Australia to take a call at the same time as someone in Brazil or in Finland, is hard. But it works online. And it saves a hell of a lot of travel miles too. The other thing about these thematic ecosystems, I'm going to leave you with this, is they are brilliant ways to build collaborative partnerships based around innovation. I'm not going to talk about that though. My colleague Caro is going to. Thank you very much.
Yes, thank you. Very shortly from me, to complement this introduction to the ECHAlliance as the Global Health Connector, we apply 4 teams. We work with the 4 priorities, which are green health, healthy aging, women's health, and digital health and data. And you can also see that our program for today was built around those priorities. So those are the 4 things that we consider as very timely, very big challenges for the global health, and this is something that we will also want to accelerate, discuss, and work together with our ecosystems, with our partners, with our members. Of course, this is not like the list that is complete. We, as data and digital, for example, is of course very broad topic, and a lot can be packed into that. Also, as the global connector, we engage in the international cross-sectoral research and innovation projects. We are a partner who work on the dissemination of the results of those projects, on the sustainability, stakeholder engagement, scalability, transferability plans. So if you, for example, would like to work with us, then don't hesitate and reach out to Andy or me or any of our colleagues from the innovation team. And also, as Andy said, we connect, we convene. We have a number of the flagship events that we consider strategic for us and for our community. You can see some of those events here on the slide. So we are meeting here in Barcelona today, but we will also meet shortly in June at Health Europe, and then not only in Europe, but also in Africa, in India and the US for the global event. And then in November, we invite you very warmly to our Digital Health Society Summit. Digital Health Society is our data arm, and every year we organize a big 2-day online event. Last year we had 1,200 people registered from 95 countries, so this is also an excellent opportunity to get to know us and get engaged with minimum effort, as this is an online event open for everyone. Become a member if you are not a member yet, and subscribe to our newsletter to stay in touch with us, to know what's going on. And Andy is signaling me that he still wants to say a word.
So just I always come to events like this and I think, okay, so what? The so what is, if you want to take part in anything that Caro or I have talked about, or engage with those people that you're going to hear from today, do something about it. Make that connection, join us as a member, or subscribe to our newsletter. That idea of growing that community, don't forget when we started this, we had a community of 1, okay? That's now 1,100 organizations, 80 ecosystems, 12 projects, global partners from around the globe. If you want to get involved with that, now's your opportunity. It also helps please our comms and tech colleagues who want to make sure that their QR codes work. So if you've got a smartphone, get it in, scanned up, and get involved. Okay, that's enough from us from now. Time to get the party started.
Time to get the party started, and we have a full day full of action, and as I said, built around those 4 priorities: women's health, green health, data and digital, and healthy aging. Not in that order, though. You have the agenda on the screen and also on your seats in the app on the website. So those 4 teams will guide us today, but also as a global connector, we will touch on the global aspects of the collaboration for digital health. We will speak about the collaboration, opportunities for collaboration in India, and also we will speak about the collaboration opportunities in Africa. But with this, I think it's time to start our first session.
Just so you understand, just before we go on to our first session, you'll be thinking, well, where can I get involved today? At each of these panels, there should be opportunities for you to get involved with Mentimeter, okay? So we can get some audience participation. That might be a poll. That might be a word cloud. But it's about getting input from you for what you think's important and you'll see some of those Mentimeter clouds come up. You'll see a QR codes to get involved. If you get stuck, come and see one of us and we'll help you out. But this is about getting some engagement from you as well. And we'll hopefully have time also from questions. And I say questions. Questions come with a question mark at the end, not a long statement about how important you are. A question is a question. So let's get involved as much as we can during the day. Caro, over to you now.
Thank you so much, Andy. Thank you, everyone, for being here.